Greetings everyone and welcome to our YouTube channel. If you or someone you care about deals with high blood pressure, this video is a must watch. Join us as we explore the critical importance of the proper blood pressure measurement position in predicting future heart disease risk. Let's uncover why this technique matters and how it can impact our cardiovascular health. You see, accurately measuring blood pressure isn't just about numbers on a screen. It's about understanding the very real risk of developing heart disease, stroke, kidney issues, heart failure, and even mortality. But here's the kicker. Are we measuring it right? The current guidelines suggest a specific posture for blood pressure measurement. Seated, both feet firmly grounded, your cuffed arm resting on a flat surface and ideally at heart level. It sounds straightforward, right? But does this positioning truly reflect your future heart health? In this captivating journey, we are unraveling recent evidence-based discoveries about the best way to take blood pressure that predicts future risk for heart disease. Let's get started. To begin, let's briefly discuss how increased blood pressure affects heart function. High blood pressure, also known as hypertension, ignites a cascade of havoc within the cardiovascular system, relentlessly creating stress on walls of heart vessels. With each increase in blood pressure, the delicate linings of blood vessels endure tiny tears, inviting cholesterol to infiltrate and form plaques in the damaged vessels. Over time, these plaques narrow the arteries, choking the vital flow of oxygen-rich blood to the heart muscle. Strained and starved, the heart struggles, paving the terrible path towards heart disease, a testament to the subtle grip of hypertension on heart health. Yet, armed with knowledge and resilience, we can fortify our heart against this silent assailant. Let's turn our attention to the role of supine hypertension in heart disease based on the Harvard study. As we will reveal in the course of this video, hypertension while asleep is strongly associated with cardiovascular disease and death. But whether hypertension detected in clinic while the patient is lying flat on the back is a risk factor for heart disease independently of the patient's blood pressure while seated remains unclear. To unravel this mystery, a team of investigators from Harvard Medical School reviewed health data for 11,369 adults from a long-running atherosclerosis risk in community ARIC study. Interestingly, none of the participants in the study had a prior history of coronary heart disease, heart failure, or stroke. Over 3 years, data on supine and seated blood pressure were meticulously collected, revealing fascinating insights. Now, both seated and supine hypertension were defined as systolic blood pressure, that's the upper number, greater or equal to 130 millimeter mercury, or diastolic blood pressure, that is the lower number, greater or equal to 80 millimeter mercury. Now, diving into the heart of the matter, the study reveals striking revelations. 16% of individuals without seated hypertension exhibited supine hypertension, while a staggering 74% with seated hypertension also displayed supine hypertension. The study further revealed that supine hypertension emerged as a significant predictor for coronary heart disease with a hazard ratio of 1.60. Pause for a moment. What does this mean? The hazard ratio in this case simply means that individuals with supine hypertension progress to coronary heart disease 1.6 times faster than those with normal supine blood pressure. But wait, there is more. Heart failure risk escalates by 1.83, stroke risk by 1.86, and fatal coronary heart disease by 2.18. Astonishingly, all-cause mortality remains significant as well, with a hazard ratio of 1.43. In a twist, participants with supine hypertension, despite absence of hypertension while seated, face similar elevated risk as those with hypertension in both positions. This revelation underscores the gravity of hypertension in all its forms, urging us to heed its warning signs for our cardiovascular well-being. Let's distill the key takeaways from the study. 1. Monitoring blood pressure while lying down offers deeper insights into heart disease risk than seated blood pressure readings. 2. Supine hypertension presents an independent risk for heart disease, urging us to explore its mechanism further. 3. Even if you do not have typical risk factors, it may benefit to undergo supine blood pressure assessment for proactive heart health monitoring. 4. This study also informs us that relying solely on seated blood pressure measurements might miss potential cardiovascular risk linked with supine hypertension. Yet, here is the challenge. In a busy clinical practice, it is impossible to do both seated and supine blood pressures. This is where electronic gadgets and ambulatory blood pressure monitoring step in as a crucial tool. Now, a question to ponder. Have you thought about monitoring your blood pressure while lying flat on your back? Join the conversation in the comment section below. Your insights count. Together, let's pave the way for a heart-healthy tomorrow. Now, let's look at the link between nighttime elevated blood pressure and heart disease risk. In general, most people sleep by lying on their backs. That brings us to another interesting question. Does nighttime high blood pressure spell trouble for cardiovascular health? Guess what? In the rhythm of life, hormonal changes such as cortisol, acetylcholine, insulin, angiotensin, and aldosterone are elevated during the day and decreased when we are asleep. Fluctuations in levels of these hormones are responsible for higher daytime and lower nighttime blood pressures. In a twist of fate, while most people experience lower nighttime blood pressure, some face elevated levels during sleep. But what does this mean for cardiovascular risk? A compelling study in the Journal of Hypertension, comprising of 8,000 participants across 3 continents, revealed a sobering truth. Nocturnal hypertension results in increased risk of heart disease and all-cause mortality. Be aware that in the latest American College of Cardiology and American Heart Association guidelines, nocturnal hypertension is defined as systolic blood pressure greater or equal to 110 and or diastolic blood pressure greater or equal to 65 mm mercury, which corresponds to daytime blood pressure of greater than or equal to 130/80 mm mercury. Now, do you or someone you know pass this blood pressure threshold? Let me know in the comments below by joining the conversation. Next, let's find out what the study reveals about younger participants. Well, in a stunning revelation, the study uncovers the profound effects of nocturnal hypertension, particularly among younger participants. All-cause mortality soared with a hazard ratio of 1.99, equating to almost twice the likelihood of death compared to counterparts without nighttime hypertension. Furthermore, non-smokers, less obese individuals, and younger participants with a history of cardiovascular disease all face escalated risk as well. These findings spotlight the urgent need for proactive health interventions against nighttime hypertension. You may be asking, what could be responsible for this increase in hypertension while asleep? Here is the deal. As we sleep, lying down relaxes our body. This happens because of increased blood returns to the heart while lying flat, especially from the lower part of our body. The increased blood volume to the heart during the night, in addition to sustained increase in hormonal levels such as cortisol, acetylcholine, and insulin in certain individuals, result in increased blood pressure. This increase in blood pressure can put extra stress on the kidneys and heart vessel walls, and thereby affecting their functions. Understanding these nighttime changes reminds us of the intricate dance our bodies perform each day, urging us to cherish our health and embrace the journey towards deeper understanding and well-being. In conclusion, we should consider this study revelation not as a cause for alarm, but as a rallying cry for action. Picture this: a treatment approach known as chronotherapy holds the key to effectively managing asleep or nighttime hypertension, offering a pathway to reduce nighttime blood pressure and shift from unfavorable blood pressure patterns to the embrace of normalcy during sleep. If you or someone dear to you grapples with asleep hypertension, know this: reaching out to a healthcare professional can be the pivotal step towards tailored solutions that cater to your unique needs. Remember, understanding empowers, action transforms. Together, let's embark on a journey towards vibrant health and well-being. And also, don't let this moment slip by without sharing this vital information with those you care about. For more enlightening discussions, don't forget to like, share, and subscribe for more insightful content. Until next time, stay inspired, stay informed, and stay healthy.